I'm Dr. Scott Brown, board-certified chiropractic neurologist in beautiful Lakewood, Denver, Colorado. And tonight I'm here to talk about our special little guys and girls. 1 in every 91 kids today is born with autism. As early as 1980, that was 1 in 10,000. And back in the 60s, it was unheard of. You've probably heard about the theories, our food supply, toxins, difference in parenting, and of course vaccinations. And we're not here to talk about all that, because probably those things are involved. But the treatment for these conditions, by and large, has been cookie cutter and based upon theories that really don't specify and identify the areas of the brain involved. For instance, there's probably 7 or 8 theories of autism. One is called central coherence, one is called functional disconnection, one is called theory of mind, one is called executive function, and the list can go on. But we think all of these theories can be explained by one thing, and that's called hemisphericity, which is that one side of the brain is significantly under-functioning. The question is identifying not only which side of the brain is under-functioning, but which lobe of the brain. Is it involving the frontal lobe, the parietal lobe, the temporal lobe, the occipital lobe, the brain stem, or the cerebellum? And the answer to that question is it involves probably all of those areas, some in some children different from the others. And that's why our treatment is different and why it's effective in brain-based therapeutics, because we look for the individual child's area of brain function in our examination and testing. So let's look at etiology. And here's what science has shown us about these kids. There's an area of the brain called the cerebellum, and particularly called the vernus. And these kids have been shown to have a smaller area of cerebellum on usually one side of the brain, either right or left. And other kids will have an area called the corpus callosum, which transmits information from one hemisphere to the other, which is only 40% efficient even for us so-called normal people. If that is also has even less efficiency and you have a decrease in function on one side of the brain, then the probability is you're going to have deficits in function in those areas. Then there's an area of the primitive limbic system. That's our emotional system, our survival system, called the anterior cingulate, which is normally a little bit smaller in some of these kids. And then the frontal lobe, you know, the executive function area of the brain. And then an area called the striatum, which is the primitive basal ganglia, which involves movement disorders and movement activities. Now, these kids do have motor and cognitive problems, and they're explained, we think, by deficits in not only one hemisphere, one side of the brain or the other, but in these parts of the brain. In brain-based therapeutics, we're not going to put your children on a cookie-cutter program that one size fits all. We're going to look individually to see which areas of the brains are involved, which hemisphere is involved. For instance, the Aspergers syndrome, which is considered the mirror image to autism, is typically considered the right brain autism. It's the little professor syndrome. Totally great in verbal activities, but not very good with social things. And then the true autistic is considered left brain, but it's not always the case. And little boys are different from little girls when it comes to which side of the brain is involved sometimes as well. Again, it is something that has to be individually tested. There are less than 1,000 of us worldwide who are trained in functional neurology and the treatment of these types of conditions. Now, you can get on our waiting list and if you get in touch with my team, they will put you on the waiting list. But what I like to do is to speak with you personally for 5 minutes to see if this is the right place and if you qualify. Because really, this is not about a magic bullet. It's not a pill or something that you can take and just hope that everything will be fine. This is about work. It involves work on both parents' part and on any caretaker's part. So to pre-qualify, I will spend 5 minutes on the phone with you, and then you can get on our waiting list. For those who can't wait I can try to find someone in your area that can accept your case, or if you're in a different part of the country, I'll try to locate someone who can help you. I really love working with these kids. I wish I could treat everybody's kids, but the ones I can't treat personally, I would like to help. And so you can get in touch with my team, and I would be happy to speak with you personally. And I look forward to serving you in whatever capacity I can. Thank you.